What's up guys, Dr. Antonio Webb here. I'm an orthopedic spine surgeon here in San Antonio, Texas. It's about 5:30 a.m. About to go get a workout in, and you guys are gonna hang out with me, day in the life of a spine surgeon. Let's get it.
Hey, how can I help you?
Hi, this is Dr. Webb. I was paged.
Yes, give me 1 second.
Get phone calls, middle of the night, late night, early morning. This is about a patient that I did surgery on a couple days ago, and the nurse is just paged me and says she's having some bleeding around her incision and also her dressing cell. Hey, this is Dr. Webb.
Hey, Dr. Webb. I wanted to let you know that her incision on the back was actively bleeding, so I did have to change it and apply it.
Yeah, I would have put a couple ABD pads, apply a little bit more pressure so it stops bleeding. Okay, thank you so much. I'll be around to see her. As an attending, you're always on call. So as a resident, you get protected because of the work hours. But a patient that I did surgery on at any point can go to the ER or call our answering service and say, hey, I'm having pain. I got a call the other night at 2 o'clock in the morning. I had to pick up the call, see what was going on. So part of being a surgeon. All right, so I just got done working out, just took a shower. It's about 6:45 a.m., about to grab something to eat and then head to the office. Have a few patients that I need to see in office, have a meeting, consulting meeting. And I'm gonna call my barber to see if he can squeeze me in. Looking kind of rough here, so time for a haircut. Thank you, appreciate it. So I usually wake up 4:30 every morning. If I wait till after work or in the evening, most likely won't work out. Something always comes up. Patient comes in, surgery, emergent surgery, phone calls, consultations, things like that. So I try to get my workout in first thing in the morning, and also gives me a lot of energy. I feel really good right now. I'm awake, energized. I went for a run, did some weights, stretched, took a shower, and get the day started. So. All right, so I just got to my office, about to see a few patients and then head to surgery. Clinic can be very busy. On a full clinic day, we see probably 50 to 55 patients. But that's me, and I have 2 nurse practitioners that help me. We all work together. So we see patients that are pre-operative, which means before surgery, patients that are planning for surgery, or new patient consultations. As a surgeon, can be a very busy lifestyle, but it's very rewarding, very gratifying, because patients come to you in severe pain, and they've been having pain for years, and I'm able to do a surgery that can alleviate that pain. So when they come back in clinic, they're happy, they hug you, sometimes they're crying. That's very rewarding. Makes all the years of hard work, all the sacrifice, dedication kind of worth it. Hello. Hi, I'm Dr. Webb. All right, so I just saw a patient who has a large disc herniation. This patient has failed conservative treatment, which means multiple injections, physical therapy, pain medications, and is having severe pain down her leg. So I offered her a procedure called a minimally invasive tubular retraction, or MITR. This is a procedure that I use a small tube like this here. We remove the pressure off of the nerve. So essentially a really small incision on the back. Then this is used to dilate the muscles. I put it right over this bone here, and I do the whole surgery through this tube here. So really small tube, really small incisions. The goal of the surgery is to relieve the pressure off of the nerve. So the recovery time for this is 4 to 6 weeks. Patient does not need a fusion, hardware, screws. I try to avoid that unless absolutely necessary if a patient has instability. But really successful procedure, and I think she'll do well. All right, so I just finished clinic. I got a hold of my barber, and he said he will be able to fit me in. So I'm gonna get a quick haircut, and then we head to surgery. So today I have two surgeries. One is a gentleman who has a large disc herniation. I'm going to do a decompression, which means we remove the pressure off of the nerve. And the second case is a gentleman who has severe stenosis or tightening of his spinal canal. The goal of that surgery is to decompress him and also fuse him. Both of these are minimally invasive surgeries that patients do ultimately do better. Less blood loss, less pain, less time in the hospital. So looking forward to it.
In the building now. Every day, man, I'm putting all this work in. So precise, man, I'm doing like a surgeon. Like a bird, man, I'm flying in the clouds. Make no mistake, man, I'm built like I'm Tarzan.
All right, so just got a fresh cut. About to head to the hospital. I have a few patients that I need to see and round on. These are patients that are in the hospital that just need to check and see how they're doing, hopefully get them home. I have a quick consulting meeting, and then we're gonna head to surgery. Let's get it. This is a consulting call. It's one of the things that outside of kind of my normal practice as a spine surgeon, I do some consulting for companies. Basically, I just want to get my advice, expertise, knowledge about the field of spine surgery, about certain things in spine surgery. So I'm gonna jump on that Zoom call. Hello. Hey, how are you?
Good.
All right. We'll take good care of you. Things will go well today, okay? All right. So hopefully we will get started with the case here. This case takes about 45 minutes or an hour. Really fun procedure. Patients do fantastic. Looking forward to it.
You're a writer.
All right, so we just finished our first case, pulled out a good amount of disc and took the pressure off the nerve. So hopefully the patient, the goal is for her to wake up and have resolution of her leg pain. So we're gonna go meet the patient for the second case, which is a lateral fusion, gentleman who has pretty severe stenosis, pretty severe collapse, and also a little slippage at that level. So the goal is to decompress him and also fuse him. I'm gonna go make an incision on the side here, on the left side, and then put a spacer in there to kind of elevate it, jack it open. It's kind of like when you're putting tires on or elevating or jacking up your car. That's what we're trying to do. That hole, that foramen can be compressed down, be collapsed. So put that spacer in there to open it up and screws to kind of stabilize it. So get started here soon. All right, so we're gonna go check on the patient at this point, see how she's doing. Hopefully her leg pain has gotten better. Usually most patients wake up and have pretty acute resolution. It means it resolves fairly quickly. Just want to go check on her. I always like to check on the patients before I leave for the day, see how they're doing. So, how are you? How are you feeling? Yeah, how's your leg feel?
I don't have that sharp pain anymore.
Excellent. So all that sharp pain went away. At the end, I made sure that nerve was completely free. So, but you did great.
You
Yeah.
did great.
Yeah. All right.
Thank you.
Yep, no worries. We'll check on you a little bit later. So as a surgeon, hours can be really hectic, which means getting home late at night a lot. I told my wife that I'll be getting home a little bit later tonight because of our cases that got started late. So I'm gonna call my 3-year-old who's been wondering where Dad is and see how he's doing. What's up, Austin?
Okay, but if you want to see him, then we can't talk to him in the car. You have to look at him on the phone.
What's up, buddy? Where are you going? You going home?
Where did we just go? Where did we just go?
Oh, you went to the jumpy place?
Huh?
Yeah, Daddy has one more surgery, okay? Then I'll be home a little bit later.
Where?
A little later tonight.
But you said you want Daddy to come in and give you a kiss in the morning before he goes to work.
Yeah. All right, I love you. Okay, I'll be there a little bit later tonight, okay?
Dad?
After we go to sleep.
I'll go.
Yeah, I know.
I'll see you.
You want to see me? Yeah, you'll get to see me a little later, okay? All right, I love you.
Bye.
All right, bye. All right, bye. So, life as a surgeon, crazy hours, a lot of sacrifices, but I mean, I love what I do. All right. Good morning. Okay, everything's gonna go well. We'll get you something to eat after. No worries. A bone marrow aspirate. This is a Jamshidi needle. Just going to take a sample of his blood through the bone there. Have a mallet, please. So we're basically taking his stem cells. We're going to use that for the fusion. So this syringe here is going into the iliac crest. We're going to draw some blood. We're going to mix that with our bone graft. That's how we're going to get us level to fuse together. This is the disc that we're pulling out right here. This is what's causing all of his pressure that's pushing on his nerves. No, man. All right, we got him decompressed, and also we got the pedicle screws in for the fusion part. I think he's going to do well. He had some weakness in his leg, and we'll have to see if that improves, which I think it will. So that kind of concludes our day. Thank you guys for hanging out with me. It's been a fun, long day. We're going to do it again tomorrow. But thank you guys for watching. This is Dr. Webb. Make sure you subscribe. We'll see you next time.